What's up, movers? Today we're going to discuss and demonstrate ways to decompress that foot, ankle, and that calf region so that we can have a cleaner and easier range of motion, from opening up the joint space to opening up the muscle, the tendon, and the skin. So let's get into it. So the reason why I like using the Remove Power Band, because it allows you to separate those joint spaces and really open it up, and you're going to feel a significant improvement with your overall range of motion within that joint structure. Now, this is intended to open up the muscle, the skin, and the joint. If you have joint abnormalities and ligamentous structural issues, you're going to want to use caution when using this. So what we're going to do is we're going to first do the TZ1 position where we're going to load up that foot and ankle. We want that power band just at the distal tib and fib. So once we're in this position, TZ1 is the basically foot contact when the foot hits the ground. So in this position, we're going to do little micro squats, and you're going to feel that tib and fib pull from the talus and really open up that ankle mortise. So that's the sagittal plane. We want to go and do an internal rotation so that we get more of that outside aspect of it. And so again, we're going to rock in that mini squat and feeling and appreciating that joint space open up without pain. So to hit that medial side, we're going to spin the foot 45 degrees the opposite direction. So we're pulling more on that tibia at this point, and continue with that mini squat. Now we want to make sure that that knee goes over your foot. We don't want to see that knee going outwards because we're going to end up putting torsion into your knee. So make sure that knee is going straight over the foot and the toe. So once we're done 5-7 reps of each of those, we're going to spin around and hit that posterior side. So we're going to stay in that loaded position. And this is going to be a great strategy for the Achilles. And again, we're going to just do that mini squat and get that tissue work done on that Achilles tendon. And then we can turn, which will get more of that peroneal muscles. 5 to 7 reps. And then we're going to go on the inside. We're going to get the medial aspect of the Achilles tendon, but we're going to get a little bit of that posterior tibialis as well. So again, with that mini squats. And then we're going to open up again to the front, but now we're going to position it in TZ2. So TZ2 is the push-off phase of gait. So we want to keep that power band nice and low so it grabs onto the skin. We're getting the push-off phase of gait, and in this position, we're going to still do those mini squats. Again, we don't want any pinching, but we're just appreciating that joint being pulled and separated, open up that joint space. So we'll do 5 to 7, turn in, internal rotation, 5 to 7 to get that outside, extra rotate, 5 to 7 to get that inside, or that medial aspect of the tibia. So have fun with it. I pretty much guarantee that you're going to feel a much more open joint space and fluid range of motion within that ankle mortise, the calf, the Achilles. The foot's going to thank you as well. So get out there and remove today.